An independent panel voted today to recommend the emergency use authorization of the Pfizer coronavirus vaccine. FDA approval is likely in the coming days. As soon as that happens, public health experts will work to help get the vaccine to those who need it most. But convincing certain communities may prove to be a challenge. America's first COVID-19 vaccine gets the green light. And now the work to get millions of Americans vaccinated begins.
Although this vaccine has been record-breaking in its development, we are comfortable, very, very comfortable with the science we've reviewed.
But not everyone is convinced.
The big thing that we're seeing is the not me first phenomena, right? A lot of people are saying, I'm going to wait a little bit.
Dr. Joe Betancourt at Mass General is one of several community leaders trying to get people to trust the science. He and his team use YouTube to share public health messages in different languages that are easy to understand. The videos are aimed at dispelling misinformation that often leaks into communities disproportionately impacted by the virus. A recent Pew Research study found 7 out of 10 Black Americans know someone who has been hospitalized or died because of the coronavirus, but only 40% say they would get vaccinated. That's compared to 63% of Latinos and 83% of English-speaking Asian Americans.
I think for communities of color, clearly there is a long history of earned mistrust based on issues of experimentation.
One example is the Tuskegee study, a trial that tracked 600 Black men with syphilis. Researchers refused to tell patients their diagnosis, never obtained informed consent, and denied them treatment, causing needless suffering. That went on for 40 years until the unethical trial came to an end in 1972 and changed the course of medical ethics.
This has been historically our experience.
Dr. Gloria White Hammond is the co-pastor at Boston's Bethel AME.
It's also confirmed in the reality. And so much of what we are seeing now in terms of the disparities are a function of current existing racism within the healthcare system.
Where do you bridge the gap?
I acknowledge what people's concerns are, and then ask them to tell me more. And then I share with them, if it's okay with them, what some of my thinking is and why I would hope that they would at least consider getting the vaccine.
Federal regulators say both Pfizer and Moderna shots are safe and highly effective. Initial reviews of the vaccines are showing promise, and the patient pool is increasingly diverse.
Why did you decide to participate in this vaccine trial?
Fundamentally, I believe in science.
Dr. George Arroyo volunteered for the Moderna trial at the Brigham.
But after the second vaccine injection, the next day I did feel like I had muscle aches, very mild chills, and a little nausea. I felt that was a very, very small price to pay for the unbelievable, 95% rate in reducing the symptomatic COVID.
He says his lived experience helps him advocate for his patients.
When I tell them that I was participated in the trial and most probably got the vaccine just by the symptoms, when they actually know someone who went through it, I think something does change in the way they look at it.
That willingness to be transparent will be critical in persuading the skeptics. Doctors say equitable access to the vaccine in this initial rollout is the first step.
It is not just the doctors. It is not just the nurses. It is the environmental service workers that clean the rooms. It is the nutrition and food service workers who deliver the food. Those individuals tend to come from the same vulnerable communities that were hotspots. So we are trying to model equity. We will model equity with our own workforce. We believe the vaccine is safe and the best thing we could do to get back to our normal life.
To achieve herd immunity or blanket protection, experts say 75 to 80% of the American population would need to be vaccinated. The latest polling shows as many as 60% of Americans overall say they would get the vaccine.